Hi, I'm Dr. Astha Dayal and I'm the lead gynecologist at CK Birla Hospital in Gurgaon, and I have my own clinic at DLF Phase 1 in Gurgaon. Today we'll discuss on how to cure PCOS permanently. PCOS is very common and it is often overdiagnosed at a lot of times. We say that you have PCOS if you have 2 out of these 3 symptoms. Number 1, if you have irregular delayed cycles and there is less of period flow. Secondly, if you have symptoms of excessive male hormone like acne, facial hair or hair growth in a male pattern like hair on the chest or belly button or on the chin area, or hair loss from the scalp. And if you have an ultrasound evidence showing that you have PCOS, which is defined by a certain criteria called the Rotterdam's criteria. If you have PCOS, you don't have to get really stressed about it. It's just that you have to know that all your life you have to maintain a good lifestyle. You should always have a good healthy weight. You should have healthy eating habits. You should follow a good diet and exercise regime, and you should avoid stress. And if you follow these, you have a very normal life like any other girl. There is no problem in people who have PCOS if they're maintaining a good lifestyle. This is a very common question. See, PCOS has 2 reasons. One is genetic factors with which you're born with and they cannot be changed, and that is why you get a tendency to get PCOS. But you start showing symptoms of PCOS because of environmental factors. You can always reverse these environmental factors by good lifestyle and with medication, but the genetic factors you can't do away with. So you can control PCOS all through your life, but you may not be able to cure it permanently because whenever your lifestyle goes bad, it could come back again. PCOS is one of the gynecological problems which has a huge contribution from lifestyle. So naturally, just changing your diet, your exercise, having a good healthy lifestyle, regular yoga, meditation, relaxation, a good sleeping time, waking up in time, eating at time will help heal PCOS, and you could continue with this all your life and not have symptoms of PCOS all through. PCOS generally increases with age, but if you control your lifestyle well, it could reduce according to your lifestyle changes. PCOS in your younger age can cause problems of irregular periods, acne, hair growth, and weight. But as you grow older, if you don't control it, it could lead to problems like cholesterol, diabetes, blood pressure, sleep apnea, and also sometimes endometrial hyperplasia, which could become endometrial cancer if it is uncontrolled. If you have PCOS, the things that you should avoid are a high glycemic index diet, which means carbohydrates which immediately release sugar in your body should be avoided. You should avoid alcohol, smoking, caffeine as well. You should avoid high stress levels. You should also have a good sleep hygiene and a good sleeping and getting up timely, and also eating in time. So avoid a bad lifestyle on the whole. PCOS can be cured with a good diet, which means that you should avoid high glycemic index carbohydrates. You should avoid sugars and sugary foods. Also, natural sugars should be limited. Even sweet fruits like mango, chiku, banana also should be limited. Cold drinks and juices which are very sweet should be avoided. You should also avoid things which have refined flour or maida, which is all biscuits, breads, bakery items, desserts. Also, starchy food, which is a very common part of our Indian diet, like rice and potato, should also be reduced. Instead, you should focus on The low glycemic index foods which release sugar very slowly in your body, like oats or multigrain or ragi, and also focus more on protein in your diet rather than carbohydrates. We actually measure PCOS only by its symptoms. There is no need of repeating your tests again and again. If you don't have symptoms of PCOS, if your cycles are regular, if you don't have weight issues, if you don't have hair and acne issues, you can consider that your PCOS is well controlled. So you should only get worried if the symptoms start happening again, and that is how you monitor your PCOS. Milk is not totally harmful for PCOS, but having full cream milk and having dairy can increase your chances of the male hormone excess and of acne. So we tell you to avoid dairy products if you have acne because of PCOS. Egg is a high protein diet. Egg whites are good for PCOS. You can avoid the yellow part if you want to limit your calorie intake, but eggs overall are okay to be taken in moderate amounts if you have PCOS. If you have PCOS, you should follow a diet with small frequent meals. If you're trying to lose weight and you're fasting for that, it can be done in a planned way, but you should do something which you can maintain in the long run, because this is a lifestyle thing and it is a lifelong thing. So don't do crash diets because you will not be able to maintain it. Overall, if you can do a sort of a diet plan in which there's intermittent fasting, or if you're regularly following a diet plan to achieve a healthy weight, that is okay for PCOS. For good health of the ovaries and for regular ovulation, controlling PCOS with lifestyle is important, but also if you have less than 8 periods in 1 year, you should start taking medication to get a period, because if you don't get a period for more than 45 days, that is not good for your health, and you should be inducing a period. If there is an issue of severe PCOS, you might need to go on hormonal medication to improve that. If you have PCOS or otherwise also, an ideal lifestyle would include a good diet, which means less of junk food, less of refined food and processed food, taking food timely and not avoiding meals. Secondly, a good exercise regime. You should do 30 to 45 minutes of exercise every other day, and it should include some cardio. In the exercise, you should have some increase in your heart rate and some exhaustion. You should not just be doing a leisurely walk. So a good exercise regime. The third thing is you should have proper sleep cycle. You should sleep at night timely and wake up early in the morning. And the fourth is your stress levels. So if you are having a lot of stress, you should meet a psychologist, or you should go for counseling. You should involve things like hobbies and yoga, meditation, talking to friends, parents, and a lot of times depression is also a symptom which is a part of PCOS. So you should seek help if you're facing any of these issues.